you are not alone. It is allergy season. 'Tis the season for allergies.
Absolutely. With us now, Dr. Summitt Shah from Premier Allergy. Thanks for being us here. We really appreciate it.
Absolutely.
All right, give us a forecast for this allergy season. I mean, this is kind of like when you talk about like flu season. Some years it's worse, some years it's better. What's the forecast for allergy season this year?
Yeah, so, you know, sometimes I think I sound like a broken record because every year I say, man, this is going to be a tough one. This is going to be a rough one. And I think same thing for this year, especially in central Ohio. We've had a little bit of a wet winter. You know, spring is starting right around now. You know, in our central Ohio area, the spring season is so bad because of the tree pollen that comes through here. So we're in this valley, and all the tree pollen kind of stays in the valley when it starts blooming. So this spring season is probably going to be, it's going to be a rough one. And then right after the spring season, the tree season, we go into grass pollen season, which usually starts around May or June, and all kind of, and then of course there's overlap between the two. So this is a rough time of year for springtime allergy sufferers. Yeah, we were talking about that earlier. Yeah.
So what is the worst allergen to have?
Well, you know, it kind of depends because you can be allergic to lots of different things. What we were talking about earlier were more environmental allergens, right? So those pollens go up into your nose and your eyes and cause those itchy, sneezy, you know, the nose, the eye, runny eyes, the sinus infections, the sore throats. But then there's other types of allergies too. You know, of course, we have kids that have food allergies. Right. Those often, you know, can be sometimes life-threatening. With seasonal allergies, knock on wood, you're usually not worried about life-threatening reactions, but it's just really, really can be miserable.
Uncomfortable and inconvenient.
Uncomfortable, inconvenient, absolutely.
All right, tell us about this eyelet technology that you guys have got that you say can cure allergies.
Yeah.
And you mean cure permanently.
Yeah, great question. So it's based on the science that has been around for 100 years, so over 100 years, which is allergy shots. I'm not sure if you have friends or if you guys have ever tried allergy immunotherapy or allergy shots. What that is basically we can give patients who have severe allergies small doses of the very substances they're allergic to.
Is that including food allergies?
So food allergies, you can do that, but that's through an oral administration.
Okay.
So you take small bits of the foods that you're allergic to under a board-certified allergist guidance. We have patients that we do that for as well. So the same principles apply for desensitizing somebody. But for environmental allergens, we can give a small shot in the back of the arm, and we increase the dose of the cat dander or dog dander or tree pollen. And then after several years, the patient's immunity builds up and they become unallergic to the things that they're allergic to. The problem with that therapy is it takes so long. It takes about 3 to 5 years to go through that. So with eyelet, what you mentioned earlier, that stands for intralymphatic immunotherapy, and that reduces the treatment course from, let's say, 5 years to just 3 shots that's given into a lymph node under ultrasound guidance in the hip and groin area, and then you're done. And it's the same symptom relief that you would have should you have gone through the whole 3 to 5 years.
Is that something that insurance covers?
So it's not a covered service yet. Allergy shots, 100%. Every insurance company covers the traditional allergy shots. But because this is kind of a new and innovative therapy, it's not covered by insurance yet, but we still have a wait list of patients that are interested in getting it.
That's really interesting. That's really interesting. All right, give us the website where we could find you guys.
We're at premierallergyohio.com.
All right, very good. Dr. Summitt Shah, we appreciate you being here. Thank you so much.
Thank you so much.
Yeah, absolutely. We'll be right back.